Good afternoon, everybody. This is Mark Hendelson. I'm an AMAC advisor, Social Security advisor. I am with my good friend and colleague, Ken Barron. Ken and I are two retired employees of the Social Security Administration. We've got over 70 years of combined service with the agency. We were each on the front lines every day, meeting with the public, helping them navigate through the complex Social Security and Medicare systems. We're glad to be part of the AMAC Foundation team and continuing our efforts to educate our seniors about all topics relating to Social Security and Medicare. So this is another monthly webinar. We have one today at noontime, today's webinar, the one you're attending. And we're also going to repeat this presentation tonight at 6 p.m. and we'll be doing another Medicare webinar in the month of December. Again, I'd like to welcome everybody. I encourage everybody to provide us with your questions or comments in our chat. We will be responding via email or phone calls. Make sure you include not only your questions and comments, but also your contact information. And if you do contact us, please feel free to share with us any other topics you'd like us to cover, Ken and myself, in future webinars. Thank you very much. Let's get going, talking about Medicare. It's a very timely topic right now. If you turn on the TV, you can't help but see all the commercials and advertising about Medicare open season, open enrollment. Very, very stressful time of the year for many people with Medicare, questioning whether they have the proper coverage, questioning what might be a better alternative and what they need to do to make changes. So we're going to give you some basics about Medicare today. We're going to start with the first slide as to when should one apply for Medicare. If you're getting a monthly benefit check or a railroad payment, Social Security automatically will enroll you in Medicare coverage. Automatic enrollment for anybody getting a Social Security benefit check. When I say automatic enrollment, I'm talking about Medicare Part A and B. Part A being the hospital coverage, free for most people. Part B being the medical coverage, which has a premium. This year it's $174.70 for the Part B. That's the standard premium. Next year it's going up, we just learned, to $185 a month, about a 7% increase next year. There is no automatic enrollment for Part D, the prescription plan. Those individuals have to enroll in those plans. They're tailored to where you live. The plans vary from region to region. Individuals' needs vary based on the amount of medications they're taking. So Medicare does not, Social Security does not enroll people automatically in the Part D prescription plan. That's something you will need to do. If you're not getting a Social Security benefit when you turn 65, you will need to enroll for Medicare if you want that coverage. If you're still employed and covered by an employer group health plan of your own or of your spouse, you'll have a decision to make. Do you continue that coverage through the employer, or do you sign up for Medicare Part B? Or maybe you do both. You continue the coverage and take your Medicare Part B. If you opt to continue coverage and then also elect Medicare Part B, that would be secondary to the employer plan. Okay? So if you're working and you do want Medicare, you don't need to take Medicare Part B. We'll talk about that in a few minutes. You can just sign up for the Part A, which is free, Part A being the hospital coverage. Next slide, please.
Now, what we're going to talk about here, I want to point out to everyone, is probably, if nothing else during this webinar that you take away, the next slide is what I want you to remember, okay? And Mark will explain this.
And this is critical for everybody to understand. This is talking about the different enrollment periods. If you're not on Medicare, you have what we call an initial enrollment period. That's a 7-month period, 3 months before your birth month, which is your age 65 attainment month, and 3 months after. So it's a 7-month window called your IEP. And that's when you can enroll in Medicare. Again, remember, it's automatic if you're getting benefits. If you're not getting benefits, you would, during your IEP, enroll in Medicare, A and B, or just A. If you're working and not taking the Part B because you have employer coverage, you can refuse Part B and Part D and sign up for those coverages at a later date with no penalty for late enrollment. And we'll talk a little bit more about that. So B and D has a special enrollment period for those people who refuse those coverages at 65. You would sign up for those once your employer health plan coverage ends, and you would not be charged a penalty for delaying that enrollment. General enrollment period is for those people who say, you know what, I don't want Medicare. I'm not covered under an employer plan, but I don't want Medicare at 65. I can't afford it. I'm healthy. I just don't want it. Well, if you refuse it at 65, the only time you can enroll in Medicare would be during the GEP, general enrollment period, which is January, February, and March. Coverage would be effective the following month. So if you enroll in January, it'd be February, you'd have the enrollment. You enroll in February, it'd be March, and so on. So that's your GEP, general enrollment period. Your open enrollment period, if you're looking to change plans, that's from October 15th to December 7th. That's the OEP.
Which would be what we're in now.
Exactly.
Yeah, yeah. And you know what, Mark, just to point out, that general enrollment period just recently changed. If you remember when you and I were working, that general enrollment period for those who decided way back when, hey, I don't want Medicare. That's it. The one thing I would hear once in a while, I'm not giving the government another penny, and all that, and they wouldn't sign up for their Medicare. Then come to find out they should have, and they're stuck having to enroll, but they can only do so during that January to March. It used to be you signed up then, but the effective date was only July 1st of that same year. Now that's changed, okay? And so, folks, you can see, but I hope and we hope never to see any GEP people, okay? You should sign up when it's necessary. And this is the big part of doing our webinar today.
And there are very few people who don't take it at 65.
That's correct.
Unless they're covered under employer plan. It's very rare when we have to look at GEP enrollments, because then that means usually there's a penalty involved. It's a penalty for life. So again, most people understand the importance of taking Medicare timely at 65 or during the SEP enrollment when the coverage under the employer plan ends. Let's talk a little bit more about, do you need to take Medicare? Do you need to take Social Security when you enroll in Medicare? And the answer is no. Medicare Part A is hospital, it's free. Part B, outpatient services, doctors, medical tests. That's the one where there's the premium going up to $185 next year. Part D is your drug plan. We talked about that. Plans can range anywhere from $40 to $60 to $80, $100, depending on how comprehensive a plan you need. The more meds you take, the more comprehensive a plan, the more costly it's going to be. So you have A, B, and D, which is also known as original or traditional Medicare. And then Part C is your Advantage plan, your MA plan. Very popular plans. That's a plan that bundles all different coverages. It could be dental and vision and hearing, and there's a lot of different coverages that are included if you go the Advantage route. Okay. But the key takeaway is you can sign up for Medicare without signing up for monthly benefits. The Advantage plans, as I've touched on, it's Medicare Part C. Beginning this last open season in 2023, more people after that enrollment period, after that open season, more people are now on Advantage plans than are on traditional Medicare. These are plans, again, that are offered by private companies. They require using in-network medical services, often require pre-approval for healthcare services. As I mentioned, it's where they bundle your vision, drugs, dental. Usually the cost is the same as Medicare. Where you're saving money is you're not having to buy that supplemental policy, that Medigap, that most people purchase when they have the traditional Medicare. In 2024, MA plans, there were 43 plans based on zip code specific. So these plans, again, you're dealing with networks. So what's available where I live in Orlando, Florida, is going to be different than somebody who might be listening today who lives in New York, New York. Okay, so those plans are very tailored to where you're living, where you're residing. Okay.
Yeah. And the other thing too, Mark, just to add to that, we have heard from folks who had one of these Medicare Advantage plans when they were living in New York, and they end up by moving to Orlando, and they forget to check with their plan whether it's going to cover them down here, because they are kind of zip code specific, different areas, because they are different companies, insurance companies. They may not cover some things that they did in New York and you get done in Orlando. So it's always a good thing to check if you have one of these MAs. And I think many times they allow you to actually change because it's kind of a life-changing event as well. So
Medigap, I touched on briefly. Medigap is basically a supplemental insurance plan, private insurance, which will be secondary and fill in the gaps from your traditional or original Medicare Part A and B. You can see there's numerous plan types. Not all plans are available everywhere. Premiums vary depending on age and coverage. For Medigap, that's a secondary cost on top of your standard Medicare premium. And the beauty about Medigap, it's covered by all medical sources that will handle and accept traditional Medicare. Okay.
So Mark, you want me to take over from here?
I'm not sure what slide is this where
I am looking at, do I need to take Medicare at 65?
Okay. Yep. That's great. Go for it.
Okay. You know what? Mark touched upon it earlier, folks. And this is something we hear from a lot of folks about. Hey, look, I'm working. I'm turning 65 in a few months. I'm covered under my employer, or I'm covered under my wife or husband's plan. Do I really need to sign up for, at Medicare at 65? And it depends. It depends. Here again, not any there's no two people that are alike, okay? So it depends on your situation. If you are covered under an employer group health plan at 65 and beyond, okay? Now, beyond, I'm going to say at least a good 3 months or more, okay? You won't be retiring, or your spouse won't be retiring. You probably don't need Medicare right away, okay? You can sign up for Medicare Part A. It doesn't cost you anything, But there could be a drawback to that, and I'm going to touch upon that in a few minutes. The Social Security benefit at age 65 is automatic if you are receiving Social Security. Okay, you're getting Social Security benefits before 65, you're automatically going to get enrolled in Medicare, at least Part A. You have the option of returning your Medicare card and saying, no, I don't want Part B right now because of an employer group health plan, whatever reason it might be. Look, you can decline Part B, but don't forget, folks, don't do it just on a whim. Educate yourself. Get in touch with us if need be. Send us an email. Give us a phone call, and I'll give you that information later. We'll ask you what the specifics are of your situation, and we'll tell you what needs to be done. Okay. If you decline Part B at 65 when you should have had it, and decide later on that you want to enroll in Part B, depending on your situation, you can enroll, but you may be paying a penalty for it, and that's usually an increase of 10% higher than the current premium for every 12 months that you're not under the Part B plan. Okay, and Part D as well, if you decide to do that later on, and you probably should have done it earlier. So you can defer enrolling in Medicare if you have what they call creditable health care coverage from your employer. Okay. And then that falls under what Mark just covered a while ago. That falls under a special enrollment period. And that special enrollment period is when you decide to retire. And so you contact Social Security within a few months before retiring, and then you enroll for your Part B and or your Part D, and you'll pay whatever the current premium is at that time. There'll be no penalties. So you could be 70 years old and just finally sign up for Part B and D, and you'll pay whatever the premium is at that point. Now, if you're 70 years old, you never took the Part B, and you had no reason not to take it because you really didn't have any creditable health coverage back then, you're going to pay a penalty. And that's for life, folks. Okay, so don't forget that. Now, very important, again, this is something I need to touch upon, is that if you are on Social Security disability insurance, I don't care if you're 22, 32, 42, 52, doesn't matter what the age is. After 24 months of receiving Social Security benefits, you are automatically enrolled in Medicare. Okay. Same provisions apply as far as not wanting Part B or enrolling Part B and D and so forth. Okay. But this is for the disabled individuals, but it doesn't start until you've received 24 months of qualifying benefits. It's a qualifying period. Okay. There are a few exceptions. There are a few exceptions to that. Now, Congress, whoever the powers that be, they got together, they decided, you know what? If you have ALS, otherwise known as Lou Gehrig's disease, you get Medicare automatically as soon as you start getting these disability benefits. Okay. So there are a few exceptions. This is one of the major ones right here. All right. So remember a while ago, I told you at age 65, if you are receiving Social Security benefits, you automatically qualify for Medicare. You get your Medicare information. Now, this also applies for people who decline Medicare at 65 because they have a creditable coverage under the employer group health plan. One major reason that a lot of people don't sign up for Medicare because they are contributing into a health savings account. Be careful, folks, okay? Be very careful. And there's a lot of online information about this. Medicare has it in its own website. If you are contributing into one of these Medicare high deductible plans, and your employer's putting in also that is tax deferred and everything else. Once you're on Medicare, you can no longer contribute into an HSA. Again, once you are on Medicare, you cannot, it's IRS rules, folks, you cannot be contributing into an HSA, which is tax deferred. Why am I making a big deal about this? Because if you are past age 65, many people delay applying for their retirement well past their we call their full retirement age. So let's say that you waited till 70. Good to use as an example. At age 70, you decide, okay, I'm maxed out my Social Security benefits. I'm getting all those delayed retirement credits. I'm now applying for my retirement benefits. It will include Medicare. You cannot opt out. You will automatically have Part A of Medicare. Here's the thing. Since you are past your full retirement age, Social Security retroactively enrolls you for Medicare A 6 months early. 6 months earlier than the month you filed your application. Not necessarily, if you file your application the month you turn 70, it'll be 6 months retroactive from that month. But many people will file their retirement application 1, 2, 3 months before they turn 70. The month you file your application and it is processed, Social Security takes your Medicare Part A back retroactively 6 months. Now, during that 6-month period, if you contributed into an HSA, guess what happens? Those 6 months of contributions to your HSA become taxable. It will be taxable. So heads up, if you know you're going to be applying for your benefits at age 70 or 69 or 68 in 3 months, whatever month you decide to apply for your Medicare, stop contributing to your HSA at least 6 months ahead of time. Plan ahead. Plan ahead, folks. Stop contributing towards that HSA 6 months ahead of the month you plan on applying for your benefits. Okay? You do so, there's going to be penalties to pay. That's the bottom line. It's not something Mark and I are making up. It's a federal regulation. It's out there. IRS's, website, Social Security shares this. The CMS, the Centers for Medicare Services, who overlooks Medicare. It's all over there. You should stop. Okay. All right. Let's move this on. Now, here's a popular one during this time of year. Irma. And I'm not talking about the hurricane we had down here in in Florida or any other place, but IRMA is short for Income Related Monthly Adjustment Amount. What is this? Another IRS rule. Okay. So people this time of year are starting to receive letters from Social Security that are basically telling them that your income 2 years ago is now going to affect your Part B and Part D premiums in 2025, next year. If you have over certain amounts of income, you are assessed an additional premium on top of that. And these premiums have just been released. We're going to cover those premiums, folks, next month, in next month's session, okay? There's a lot of information to cover there as well. We don't want to take that much time today, okay, to go over each and every premium because there are different levels of income. So this IRMA is based on what we call the modified adjusted gross income. If you take a look at your tax return, it's also referred to, we have all these acronyms and we try to keep away from them as much as possible. If you walk into a Social Security office, you won't understand the lingo because, the IRMA doing the Magi and then whatever it is. I mean, it just gets to be kind of funny after a while. But modified adjusted gross income is Magi. It's from your tax filings from 2 years ago, prior to the current year premiums. So current year premiums, we're talking 2025. They're going back to 2023's income, your monthly, your modified adjusted gross income for that year, okay? Whatever figures come up is going to determine your premiums. Now, the new $185 Part B premium for next year, that is a base rate. That is a base rate with the balance of the Medicare premium being paid by the government. Okay, that is the balance of that. Medicare, if you were to purchase Medicare today, both Part A and Part B, if you had never paid into Social Security and paid Medicare taxes and so forth, you'd be looking at $600-700 of premiums between Part A and Part B to purchase it. Okay, Medicare's no cost to you because you paid into Social Security. You paid Medicare taxes as well. Okay, throughout your career. Now, it is a fee that you do pay on top of your Part B and Part D premium. So on top of the 185 for Part B, there's going to be an additional premium. And that brings you, and it depends on your annual threshold of income from, again, 2 years prior. It does apply to individuals. It can apply to couples based on that magi. It does apply whether you have original Medicare or the Medicare Advantage plan. Okay, so you really can't get away from it. Now, there are ways of getting out of it or being, I like to say, excused from paying this penalty. And it's called life-changing events. And here again, if you want to research that before we do our next webinar, where we're going to address that, okay, you can go to Medicare's website or Social Security's website and just put in life-changing events under Medicare or IRMA or Magi. Somehow, some way, you will get that information popping up, and it tells you how you can contact if you get a letter saying, okay, on top of the 185, you're going to pay an extra premium, and you say, yeah, but this just happened 1 year, and it was because of a certain, you'll see the topics, life-changing events. It could be one big example. I lost my spouse that year, or I got married that year. Okay, so it could be something like that. You can actually get excused from having to pay that additional premium. Okay, so just so you know, it does exist, and you know, if you don't know where to go, where to get that information, you can contact Social Security. They have their toll-free number, which is the preferred method of contacting Social Security. If you are allowed to even walk into a Social Security office these days without an appointment, you can visit them at your field office. Some field offices are distance away from folks, so try the 800 number. And usually Social Security, they're open 8 a.m. to 7 p.m. Monday through Friday to answer your questions or make appointments if somebody's filing for benefits. Okay. If you can't get through to them, you rather come to Mark and I or some of our colleagues. Mark and I pretty much only deal with emails coming in. We have some of our colleagues who actually are on the phones, and our Social Security advisory phone number, as you can see on the slide, the 888-750-2622. Okay. The other, go ahead, Mark.
Yeah, we got a great question a few minutes ago from
okay. Let's do it.
One of our individuals listening to our webinar, and the question was, how do I know what do I believe based on what I hear on all these commercials on TV? Because the advertising that the insurance industry, the advertising dollars they spend, it's tremendous. Lots and lots of investment each year in putting on these commercials, these infomercials, and also sending out the brochures. I'll answer it this way. When you're listening to a commercial or reading a brochure you got in the mail, somebody is trying to sell you a product. They've got a vested interest in the company and the product they represent, and they're trying to convince you that you should purchase their product to meet your needs. That doesn't mean that is a good choice that you should be making. So I've done this a lot of years. Ken has done this a lot of years. When you get a brochure in the mail, throw it away. Okay, they're selling you a product. Again, these advertising brochures, they're very slick, they're very convincing. And people have used those to make decisions and regretted those decisions, buyer's remorse. So my initial comment was, don't pay any attention to the commercials. Don't pay any attention to what you get in the mail. I would encourage everybody. One of the superstar departments we have here at AMAC is our AMAC Medicare Insurance Department. You can reach an advisory individual who doesn't represent a company, who could give you some objective advice as to what might work for you, either your current coverage or switching to another coverage. You can contact them at 1-800-334-9330. Again, 1-800-334-9330, or reach them at myamacmedicare.com. So I'd reach out to one of our advisors. There are some good sites online that are not funded by insurance companies. You can research those on your own. The bottom line is to find somebody who is not representing a company or a product, and getting their objective opinion as to what might best meet your needs from a coverage standpoint.
Thank you, Mark. And if you didn't get all the information Mark just put out there as far as contacting the Medicare part of our advisory, send us your information and just tell us what you're looking for. You're looking to talk with someone about maybe a Medicare Advantage plan or switching or whatever it might be. We'll get your information over to them. Okay. As I keep saying, there's a guy for that, and we can send your information to that guy or gal, okay? Or give us a call, all right, at that 888 number you see on your screen, and one of our colleagues will send that information over or provide it to you, okay? So we have an open. We're here for whatever needs that you have. If we don't meet your needs, if you've gone to the wrong place for your information, we'll provide you with the information or get it over to those folks that handle your inquiry. Because, you know, we want to make sure that you're getting the right information. That's the bottom line, folks. We're not here to pick your pockets. We're not here to do, I mean, we are nonprofit. We rely pretty much on donations, okay, to pay the bills. And so don't worry. We get a lot of emails as well. You know, how much is it going to cost me to get some consultation from you folks? It won't cost you a penny. If you don't want to spend a penny, if you want to send us a penny donation, we'll take that. Okay. But listen, folks, Mark and I and our AMAC Foundation, we're here to help with the Medicare and the retirement benefits and survivor benefits. That this is our this is our forte, okay? And we want to make sure you're getting the right information, folks. All right. So please get in touch with us if you can't find the information elsewhere. If you're savvy, you're able to get the information elsewhere on your own. You know how to maneuver. You know, social media. You know, the media sites. More power to you, okay? But we will try our best. You know, I don't know if we got some questions in our chat. We have some folks maybe to get back. If you were not able to get through to us, send us an email. Again, we have someone overseeing our chat box, and that information will get to us. So again, we want to thank you for joining us for our noontime session. We are going to do another live session this evening at 6 o'clock. If you have friends who weren't able to join us today and they hear you talking about our session, provide them with our connection, and we'll welcome them in our webinar this evening at 6 p.m. Eastern time. Okay. Thank you again, folks, for joining us. You have a good afternoon. Bye for now.